You may be hearing more about perimenopause, and there's a greater awareness of what perimenopause is among physicians and healthcare providers and women. It's something that hadn't been discussed in medical training, but it's something that early on, when I started working with patients, initially as a primary care physician and now as a double board certified internist and integrative medicine physician, I recognize it's such an important time in women's lives because so many changes are taking place. And what happens during perimenopause, this is the period just before menopause, and it can occur several years before menopause, and it can widely vary in women, but typically can occur starting either in their late 30s or sometime in their 40s. And during this time, women might experience a number of different symptoms and changes in their body. So they might experience more weight gain, especially around the abdominal area. The time from one cycle to the next may be reduced in duration in the early parts of perimenopause, and then over time they might start to skip cycles, but this can greatly vary from woman to woman. The other thing that a lot of women notice are these cyclical night sweats that might start to happen just before they start getting their period. They also might notice as their estrogen levels fluctuate and rise that they're having more breast soreness, or they're having heavier periods, or potentially fibroids. Women also often report mood changes, more PMS symptoms, greater levels of anxiety during perimenopause. They also might experience brain fog or changes in memory. They might feel like they're not performing quite as well at work or not as good at multitasking as they always used to be. It's very important to acknowledge that these symptoms are real, and these symptoms should be dealt with and discussed with a healthcare provider.